Aging isn't about slowing down, it's about stepping into your power. Welcome to Don't Let the Old Lady In, the podcast where we challenge outdated beliefs about getting older and embrace wellness, self-love, and confidence. Your host is Lori Gardner, a registered nurse and nationally board-certified health and wellness coach, and she is your guide on this journey to vibrant, mindful living. Each episode will explore topics that nourish your mind, body, and spirit, and how to navigate health issues in the healthcare system as you age, so you can live with energy, purpose, and joy. Let's get started. Here's your host, Lori Gardner. Welcome back to Don't Let the Old Lady In. It's Lori Gardner again, your host and your nurse advocate, talking today again on this hospital series about the hidden injury that can start in hours in the hospital, pressure injuries, otherwise known in layman's terms as bed sores. Today we're talking about this because it's often misunderstood and sometimes completely overlooked in hospitals. These pressure ulcers, also known as bed sores. I want to start with a thought that I've heard from families many times. They're just resting. They're just lying there. They're fine. And on the surface, that makes sense, doesn't it? When someone is in the hospital, especially after surgery or illness, and expect them to be in bed, right? We expect them to be in bed resting and recovering. But here's what many people don't realize. Lying in one position for too long can actually cause injury and not just minor discomfort. I'm talking about wounds that can develop quickly, become serious, and significantly impact recovery. I could almost write a book on how many times I've seen this happen and the very life-threatening consequences of these. But the good news, many pressure ulcers are preventable. And this whole hospital series is all about prevention. Last week was about medication error prevention. The week before was about fall risk and fall prevention. So let's keep our prevention mind on, but let's not be unclear as to the consequences of all of these things. They can have life-threatening consequences. So today I'm going to show you how to recognize the risk and what you can do about it. So let me take you into a moment I've seen too many times. A patient is in bed, they've had surgery, they're tired, maybe sedated, they're not moving much, the family is sitting nearby, everything seems calm. But as the day goes on, they notice something subtle. The patient hasn't really changed position. They're still lying the same way. Hours go by. No one has repositioned them. And the family's thinking, I'm sure this is normal. Or, well, the staff knows what they're doing. Or, I don't want to interfere. They must need to just rest and not move. But what they don't realize is pressure is building on certain areas of the body. And over time, that pressure reduces blood flow. And when blood flow is reduced, the skin and the tissue underneath can begin to break down. And sometimes by the time it's noticed, the damage has already started. And families often say, I had no idea this could happen so quickly. Ladies, I can't tell you how quickly this can happen, especially when you have somebody who possibly is already undernourished. Bed sores happen, pressure injuries happen as a result of not having proper nutrition. Or they're dehydrated, the skin turgor, and that's really compromised. So this can happen really quick. And once it happens, I call it a runaway train. If we don't get on top of it, it can go right down to the bone, where they then have to have surgeries and grafts and so on. So in simple terms, a pressure ulcer is an injury to the skin and underlying tissue, right? It happens when there's prolonged pressure, as I said, on one area of the body. So here are some common areas. The heels. Think about when you're laying flat. What's on the bed? Your heel. I've seen heel breakdowns like you wouldn't believe. Your hips, you're turning on the side. Your hips can happen. Your tailbone is probably the most common place to have a breakdown, called the sacrum. Your elbows, it can happen on your elbows. It can happen on the back of your head. I've seen that also. During COVID, when we had the very smart move, and can I just say, the nurses figured that out. If we flip our patients over on these ventilators, they actually did better. But again, their foreheads were down on the bed, and they had some facial pressure ulcers. But here's the key point. It doesn't take days. Sometimes it can start in hours. I know, it sounds hard to believe, doesn't it? Especially in patients who are older, they're fragile, they're immobile, or they have poor circulation already. So think about it. You already have poor circulation. You're putting pressure on bony prominences in your body. You got no circulation. It's going to break down. So let's talk a little bit more about why this easily happens in hospitals. The biggest factor is they're immobile. Patients stay in one position, they don't shift their weight, and they can't move themselves, and pressure builds up. Another reason is moisture. We sweat, there may be incontinent of stool or bowel, there could be wound drainage. Moisture weakens the skin, and so that's another precursor to it breaking down. Like I said before, nutrition, hydration is huge. When you have poor nutrition, that equals slower healing and weaker skin. Again, you can have friction and shear in the bed. Have you ever seen anybody sliding down their bed? We got to get them up. They can slide down the bed, but that's shearing. That's causing friction, and that damages the skin as well. Some people also have reduced sensation. They don't feel discomfort the same way, so they don't shift naturally, which is why we have to rely on care partners and the staff to, move our patients. So what do we have to be aware of with all this? It's looking for those early warning signs. Redness that doesn't go away, which is why one of the things I was taught in nursing school, which is so many years ago, on the evening shift, we gave everybody a back rub, but that was our opportunity to assess the skin turgor. We look at the hips, we look at the sacrum, we look at all the bony prominences, we massage them, increase the blood flow to those areas. That's prevention. But I will tell you, as things got busier, that fell by the wayside. And it doesn't get done as often as I'd like to think it does. So you got redness that doesn't go away, skin that feels warm or firm, so it's kind of tightening up and breaking down. It's warm. It could start to get discolored, and people could start complaining of pain and discomfort. I had somebody not that long ago, a client, who was complaining of a headache, and it was a complicated case. She was complex. She was not very mobile. So she did lay on her back a lot. We relied on the staff to turn her, and everybody should be turned every 2 hours. You go on one side for 2 hours, you go on your back 2 hours, and then you go on the contralateral side for 2 hours and rotate that way every 2 hours. And when I really looked closely at her, I picked up her head. She had the beginning of bed sores on the back of her head. Nobody suspected this. So she was complaining of it, but everybody was assuming it was a headache. So catching it early is key. It prevents it from getting worse because there's actions that can be taken. And that's where you become incredibly important. So the general guideline is, as I just said, reposition everybody every 2 hours, if it can happen. I mean, sometimes people are hooked up to equipment that may prevent it. But again, work with your nurse on all of this. And ask, how often are they being repositioned? Ask it. And can we help remind or assist you with that? So really be a care partner, be a collaborative care partner, but really be pointed and say, I can be here every 2 hours to help you turn, but I really want this done. Even small things can help, adjusting your position a little bit, lifting slightly, turning side to side, moving the legs. Just any kind of movement and repositioning can be very helpful. But again, check those high-risk areas. You don't have to do a full exam, but just check the heels, the bottom of the heels, the lower back, and the hips. Those are the big areas that take it. And, I always encourage people who are at risk to get special mattresses, cushions, bed overlays, you name it, I want it for my clients. So I want it for your loved ones too. Because a lot of this cushioning and this gel, they have gel mattresses, they have everything. And I had it all when I had my big surgery, and I will say, you may have a loved one that's in the bed like I was with the pressure cushions or wraps on their legs, and that keeps the movement going in the legs, and that's tough. It keeps you awake. But all of this is prevention, so that's how we have to look at it. So you can ask a nurse, are there any pressure-relieving surface mattresses or overlays, bed toppings we can use, because I think it's important. And if you see moisture anywhere, let's get that bedding changed. Change the clothing, change the bedding, speak up. Here's some scripts. I like to kind of get some scripts going for you so you have some communication enhancements because it's not always to do so. You could say, can we reposition them if the nurse comes in? Do you have time? Can we reposition them now? I'm really watching the clock and I really want to keep them going every 2 hours, switching it up. The other thing that I haven't touched upon is people generally can get out of bed. If they can get out of bed, depending on their condition, they could walk, they could sit in a wheelchair. I know because I knew what I knew and I knew how to prevent things, when I didn't feel like walking at all, and I was heavily medicated. And I had bags and drains coming out of everywhere, it felt like, and an IV pole, but I got up because I knew the road to recovery starts with movement. And I was already a little thin, and I couldn't afford any kind of pressure ulcers. So getting up is really good, even if it's sitting in a chair. But you don't want to sit in the chair too long. You don't want to sit in the chair all day because of the pressure on the sacrum. So ask them, can we reposition my loved one? Or you could say, how often should they be turned? That's not saying, I don't know that I'd love it if a patient's family came to me and said, did you turn them? Like every 2 hours? Can I see the documentation? You want to just, let's be a little more gentle and assertive and just say, how often should they be turned, or how often are they turning them? Can I help? I know you're busy, all of that. You could also say, notice some redness on their bottom or their hips. Can we check that? Is there anything prevention we could do? Sometimes there's little units you can put, foam units you can put on the bony prominences to prevent it from always taking the pressure. Same thing in the chair. There's little gel pads they can put on the wheelchair or the chair they're sitting in to take some of the load off that buttocks area. And again, are there any special mattresses that we could be using? You can ask that as well. So families often hesitate here because, it doesn't look urgent. And in the triage of things, okay, they just had surgery. Let's say, they had open heart surgery and, I don't want to mess with the heart. And that's probably down the line. I'm not worried about it, but we do need to worry about it. It doesn't look urgent. There's no alarm. There's no immediate crisis, right? But this is a slow complication. And sometimes it gets overlooked. So those are the ones that are easiest to miss. So that's why I say you as the care partner, you're the one that is first line defense for that loved one in that bed. So instead of thinking, oh, they're resting, they need to stay still, think, movement protects their skin. And on top of that, like I said with my surgery, recovery happens quicker with movement. Not only you're out of bed and you're off the pressure points, so you're preventing pressure ulcers, but getting up and moving, your blood is flowing better. You may not like it. Get your proper pain medication before you get up and move, but that is essential. So in wrapping up, ladies, pressure ulcers are one of those complications that can develop quietly, but they can progress quickly and significantly impact recovery. But they're also one of the most preventable. So with some awareness that you're getting right now, repositioning, speaking up, and sometimes just noticing that someone hasn't moved in a while can make all the difference. And you've got this. So again, I want to encourage you to go to the carepartnerproject.org website, download your checklist. You'll also get it on the email. If you're on my email chain, you'll get that. I'll also leave this in the show notes. So leaving this, you know what to look for, you know what to ask, and you know how to help. So you are becoming an amazing, empowered care partner that will sit by the bedside and help your loved one prevent any kind of hospital issues and recover sooner. So if this resonated with you, somebody in the hospital, make sure you share it. Tell them to come here and listen to all this good information. As I said, even if you're not in the hospital or you haven't been, chances are one day we all will have some sort of experience with ourselves or loved one. Take this and remember it because, again, it can be life-saving and life-changing. So until next time, I got another series next week. Until then, don't let that old lady in, and you won't land in the hospital, ladies. Until next week. And that's a wrap on today's episode of Don't Let the Old Lady In. Remember, age is just a number. Your mindset, energy, and passion are what truly define you. If this episode spoke to you, don't keep it to yourself. Share it with a friend. Subscribe and leave a review so we can continue this journey together. You are strong, vibrant, and unstoppable. Until next time, keep living boldly, loving yourself fully, and most importantly, don't let the old lady in.